thanks very much, and good afternoon to everybody. It's in Ontario here. It is 5 o'clock. It's been a great day. I hope everybody has enjoyed the program as much as I have today. I've certainly learned a lot. So I was asked to talk today about advocacy to improve migraine care in Canada. And Dr. Becker's presentation was a great segue into what I'm going to talk to you about today. Sorry. Oops. And now I can't move my slide. Okay. So this is a bit of a busy slide, and it's just, I'm going to talk through a little bit about the current patient access environment in Canada before I dive into specifically into advocacy. So I want to give you a little bit of an overview about the process of which a medication goes through before it can be reimbursed by the provincial and the public drug plans. Dr. Becker gave a great overview of all of the medications that have recently been approved in Canada. We have lots more on the horizon, but there's definitely a challenging and complicated process that medications have to go through before you actually can have access to them. So once a manufacturer has done all of its clinical trials, it makes a submission to Health Canada. So Health Canada is the regulatory body that provides drug approvals in Canada. This approval is actually called an NOC, or a Notice of Compliance. And basically it deems that the product is safe and effective. Once an NOC has been issued, the manufacturer then makes a decision to submit it to CADTH, which is the Canadian Agency for Drugs and Technologies in Health. And I say that manufacturers can make the decision to submit to CADTH or not. If they choose not to, the likelihood of you having access through the public programs is very slim. So CADTH opens up that opportunity for public reimbursement on the provincial drug plans. So CADTH reviews the submission and conducts a health technology assessment as part of their process. And they provide, and the outcome is that they provide a recommendation of the public listing of what that should look like. If the product receives a positive recommendation, which we all cross our fingers that all medications do, the manufacturer then submits the file to the Pan-Canadian Pharmaceutical Alliance, which is short form PCPA. And this is a national body formed between the 10 provinces that negotiates the price. At PCPA, if an agreement is come to, then a letter of intent is issued, and then the file has to go to the provincial drug plans, where they make decisions upon criteria, and they add it to their individual provincial formulary. If we look at private insurance controls listings and reimbursement in the private sector. So there's approximately 60% of the population has private insurance. Major carriers have begun to start building internal health technology assessments as well. And this is something that has only started to happen over the course of the past few years. So just similar on the same slide, I just wanted to highlight that from NOC to us witnessing products being listed on the provincial formularies, on average, it takes about 2 years. Sometimes a little less, sometimes a little more. I also want to recognize that we have opportunity. Patient organizations like Migraine Canada have the opportunity to provide formal input to CADTH and INESS, and we also we also submit informal input with the PCPA, with provinces, with insurers, to help move these products along the process. And so I just wanted to, I'm not going to go into detail of this slide, but I wanted to give you a couple of examples. So if we take a look at Aimovig, for example, the NOC was received in 2008. It is currently only being negotiated at PCPA. And this has been close to 3 years since the NOC was issued by Health Canada. I talked a little bit earlier about the manufacturers can decide or not to submit to CADTH. Emgality is a good example of this. The manufacturer, although it received an NOC in 2019, the manufacturer chose to hold off and has only recently submitted the file to CADTH. So right now I'm in the midst of preparing my input for Emgality that is due in June to CADTH and ANES. And so you can see that there's other medications that are active right now as well. So the Canadian healthcare environment, well, it's complicated. There's lots of complex policies. It is under significant cost containment. There is a lot of pressure on drug costs, as you probably hear in the news on a daily basis. Well, maybe not daily with COVID, but regularly there's always talk about drug costs. And we really need to make sure that there's compelling and convincing data and evidence to drive access. It's really important that we create awareness and make people who have decision-making powers, that they understand the unmet need for medications to treat migraine. You can also imagine that because of all of these reasons, and the fact that there hasn't been new medications that have come to market in the past several years, almost a decade, with the exception of Botox. If I was a drug plan manager and I was seeing all of these new medications coming to market, I would be I'd be sweating bullets trying to figure out how am I going to pay for these drugs in my drug plan when I haven't had new medications for migraine in so long. And that will lead us into advocacy. So, we need to become a champion of change. If we all advocate together, we can really make a difference. Advocacy. For some people, it's a very overwhelming word. Some people don't know what it is. They don't know how to do it. They don't even know where to begin. And I just want to say, you're not alone. And I'll address a few questions in the next few slides. So what is advocacy? Advocacy is change. It's social change, it's policy change, it's changing the status quo. It's raising awareness to decision makers or influencers, as we commonly refer to our government elected officials. Advocacy is about collaborating. It's about working in partnerships, working together. And it really is an appeal for public support. So who does advocacy? Well, anybody and everybody can advocate. If you have an issue, a problem, or a cause that needs action or change, you need to advocate. People really actually advocate all the time. If you are talking to your doctor about different symptoms you're having and you're looking for a diagnosis, and or you're looking for a new medication, you're self-advocating. People don't realize it, but they do it every day. So we all do it, and we'll go into sort of a few other things about advocacy. So who do we advocate to? So we have elected officials and non-elected officials. At Migraine Canada, I spend a lot of time reaching out to advocate to our members of government, so our ministers and our deputy ministers of health, opposition, health critics, standing committees, that kind of thing. For individuals like yourselves at home, you would be doing more advocacy towards your local officials. So that would be like, depending on where you live, your MLA or your MPP or your MNA. You can also write letters to your minister and your deputy minister of health as well. For non-elected officials, this would be where we have conversations with the drug plan managers who are bringing information to the ministers, to the finance ministers, to create a budget line for including migraine medications in the budget. And where do we advocate? So I just went over that. It's federal, it's provincial, it's regional. In some cases, not necessarily for medication, but municipal. And the different issues that we're advocating for is access to medications, trying to raise awareness and be recognized that migraine is underdiagnosed and undertreated. There's lots of issues with access to disability programs. We need to end stigma. We need to have more neurologists who are specialists in headache. The list goes on, and so there's no lack of issues to be advocating for at Migraine Canada. So how do we advocate? Well, we do it through sending letters. We can make phone calls. And eventually what we really want to have as an end goal is to have meetings, whether they're in person, virtually, even by telephone is appropriate. But there are a few different ways that we can do that. So how do we effectively engage with government? So Migraine Canada is, in addition to all the work that we're doing behind the scenes to get medications onto the public and private drug plans and to raise awareness, we're developing an online platform to help Canadians like yourselves to self-advocate. The government also needs to hear from you about how migraine impacts your quality of life, how these new medications can transform your life, letting you, live without migraine daily, getting you back to work, just overall improvement of quality of life. So what we're designing is a platform that simply what you're going to need to do is you'll just type in your email, your name, your postal code. Once the postal code is entered, your regional people's names and emails will pop up, and you select whoever it is that you want to send the email to, whether it's your MLA or your Minister of Health. And then there will be a template that will have a little bit of information pre-populated for you. And then, I always encourage people to add their personal story because that's really what kind of grabs people. So you enter that and you simply hit send, and off it goes. We'll also have a toolkit on our platform. And so, if you decide, no, I want to write my own letter, we'll have information about how to write your own letter, where to start, what to include. You need to include what the problem is and what the solution is, and what really the call to action is. What are you asking your MPP or your Minister of Health to do? You're asking them to reimburse a medication. The toolkit will include tips on, how to ask for meetings and how to prepare for meetings, and that kind of thing. So we're really trying to create a place where you can go, and we've done all the heavy lifting for you, and make it really easy, and hopefully have tons of people writing letters to help me out. The government needs to hear from other people than me. So I'm hoping this will be a great resource for patients. And so I just wanted to end with Migraine Canada is a really young organization, founded only in the late 2018. If you've not already visited our website, we invite you to visit our website regularly. Dr. Leroux has referred to some of the information that we have on it. We will continue to add new resources and new content. If you have questions, please email or phone us. Follow us on Facebook and soon to be Instagram and Twitter. And I ask you to sign our petition and join our community. We don't have a membership per se, so the petition is really a way for you to become part of our community. And with that, you would receive notification of events, new programs, resources, just news about migraine. So I hope that you will sign our petition and become a part of us. And with that, I'm happy to answer any questions that you have.
Thank you, Wendy. That was fantastic. A little bit of a trip up at the beginning, but welcome to virtual stuff. So really amazing presentation. A lot of questions coming in about, the excellent advocacy for medications, but what about for everything else that's needed for treating migraine? And are we advocating for that or just for the medications?
Yeah, that's a really good question. And yes, we are advocating for everything. We are a very small team at Migraine Canada, so we're still in the building mode, but we would definitely be advocating for, disability, services, all the things that the community is reaching out to us about. The big thing right now that people really are being impacted by is lack of access to these great new medications that are available, approved by Health Canada, but they don't have access to it.
Excellent. So, moving to that was kind of fitting in with some of the lecture that Dr. Becker just gave us of some of the interventional treatments, such as RTMS and stimulators. Is that also something that you look at working at advocating for?
Absolutely, absolutely. We will be helping out with, in whatever way we can, with devices and any other things that people are needing access to that they're not having. So it's definitely not limited to the pharmacologic medications, but by extension to anything that is really available to Canadians living with migraine. We advocate for what the people need.
Excellent. Look, I really appreciate your time. And of course, what an amazing event working with Migraine Canada. And it's just excellent to see these kind of relationships coming together. So thank you for everything that you've done with this.